I have a question for Mr. Deporter.
Yeah, he's there.
He's here.
He's here.
Behind you.
Okay, sorry. So can you tell us a bit more regarding the technique? You're talking the neural stretch.
Yeah.
Can you explain?
It's a technique. Oh, okay, we hear me. Okay, it's a technique where you stretch the nerve on the limbs. Like median nerve, this technique is like that. And so if you do it, you will feel the stretching of the nerve. And the literature have seen that they have a reduction of the pain. And some articles have seen that they can improve the regeneration of the nerve too. The literature began to 2010. It's in the article that I have read were about neuropathies for diabetes and chemo induced. But yeah, it's a technique like we can stretch big nerves like radial nerve, ulnar nerve, sciatic nerve too, tibial nerve too, fibulary nerve too, and so we can stretch it, and the gliding technique is to stretch the nerve on the proximal and after on the distal part of the nerve. It's like for the medial nerve, it's like that. So on the proximal you stretch, but after it's you do an extension of the whistle, so that will stretch on the distal part of the nerve, and so that help the nerve to glide and to slice in the limb. And for my patients, I recommend to do muscular stretching too. I have no proof that's just case reports, but my goal is that if everything around the nerve is flexible, that will maybe improve the slicing of the nerve in the limb, like muscular articulation, etc., joints, etc.
Hi.
It's okay for the question.
Okay. This is a question perhaps for David. National organisations need money to run, and has the Alliance got any ability to assist other national organisations work out how to perhaps get some money from pharma or whatever? It's not something I've heard about today, but what's the secret?
Cool. That's a question and a half. But certainly, we've already done recently and in the past, when someone's setting up a organisation, and hopefully that will continue, we do give some support financially for that, and that works really well. It's like everything, we've all got limited funds, and being a kind of global organisations, we can't sort of do what we can't say to the French, because we're a French organisation. Right? Can you give us some of your money from your pot?
No. Sorry, I don't.
No, I know that, but I'm just. I think it's important to mention that, because we kind of have a great relationships with farmers, as was said this morning. But we also don't let them tell us what we're going to do. And we'll gladly support organisations to have that conversation, especially early on, because it's a new thing for those people. So that's where most of our kind of guidance goes to.
Yeah, thanks.
Yeah. Thank you, Susan.
Hi, I'm Muriel Finkel with amyloidosis support groups in the United States. And my question is for the GI doctor. In the States, for people with chronic diarrhea, AL and ATTR both, our doctors do prescribe paregoric, tincture of opium, things like that, if Imodium and the normal things don't work. Do you do that here as well?
Yes, if the diarrhea is only the issue and there's no pseudo-obstruction-related seaborne diarrhea, we might start with loperamide and then go to codeine-based preparations. But if it's still not controlled and there's also malabsorption, probably will also go for an intravenous nutritional support, because finally if you give the nutritional support and you give a better nutritional status, also the diarrhea also will improve. But we also try to use all medications that we have if there's no risk of having the obstruction part taking over and having the problem of the distension, and that's we're not solving the problem there, we're making it worse.
Oh, thank you. And I have a quick addendum to, getting money from pharma, because we've been doing that for 20 years now, and I consider myself a professional groveler. And so, but I do find that our pharma partners are very willing to give us money on an unconditional basis. So you just have to make sure that it is unconditional and that you don't have to do anything, no tit for tat. And I find they're very willing to do that, for sure.
Yeah, no, very much so. I think that especially for new charities, because this landscape has completely changed, hasn't it? There's so many of them that you've got to be very strong and to kind of say yes to everything that they may want to do in terms of because some of them do have needs and wants, and you could end up doing more for the farmer than you do for your patients and caregivers.
Yeah, we find in the States that they're very willing to do unconditional, and they don't ask us for anything. They may hint, but we just tell them no.
Yeah, and that's exactly the advice I'd give most people on it. Yeah, you're right.
I have a question for Benjamin. Are there any guidelines for physical therapists here in Belgium how to work with patients with amyloidosis? Because that's what's lacking in Holland. And a lot of physical therapists don't have a clue of the disease, and they work even contraproductive with their, contra-effective with their treatment. So if there are any guidelines here for all physical therapists, could we maybe get them for in Holland as well? Because there's a need for that.
Unfortunately, we don't have guidelines, and there is no guidelines in the literature, not a lot of recommendation. It's a rare disease, and so when you see the scientific literature, there is not a lot of articles for physiotherapy and for physical activity too. They have to adapt for your troubles, and each patient is different, so it's very difficult to do recommendation and guidelines. Yeah. Sorry.
They are working on it in the Netherlands, but it's not finished yet.
Spoiler.
Okay. Any other questions? There's no question from the chat. Anyway, so thank you, everybody. I mean, I don't thank myself, but so I think the interesting thing here is that complementary strategies are to consider, and we saw this in many ways. So it was quite a nice thing. Thank you, everybody.